Alrighty, so welcome everyone. We're here to kind of do an overview of all of the benefits that the county offers and some important changes that are going to be happening for next year that you should be aware of in advance. My name is Sarah Thomas. I'm the Employee Benefits Administrator for Tompkins County. I'm joined by Jess Molesky, who is the Employee Benefits and Leaves Associate. And the two of us make up your Tompkins County Benefits team. And so I'll just be walking you through some things. Jess will be helping out with that. We do ask that folks save questions for the end, or you can submit them in the chat throughout so that you don't have to remember what is on your mind, but we will address those at a Q&A session at the end. And then we'll also open it up where folks can unmute themselves and ask questions at the end. But hopefully we'll be able to answer most of those questions as we go along. So I am going to bring up our PowerPoint. There we go. Okay, so we're going to start off with the things that are new for 2024, and we will circle back and talk of these again at the end, just to make sure folks who are joining us late do get this information. So the biggest change for 2024 is that our prescription insurance is changing from ProAct to Excelis. This actually has a lot of benefits to it, having your medical and your prescription insurance kind of in the same insurance plan, because you see your doctors and then your doctors write your prescriptions. So it makes sense that those systems can talk to each other, that Excelis as the insurance carrier can kind of see what's going on, help prevent potential medication interactions, particularly if you have prescriptions that are prescribed from different providers. But there are some things to be aware of as we make this transition. So the first thing is keep on the lookout for any mail coming from Excelis Blue Cross Blue Shield this month, next month, and in December. I know I got my welcome letter, I think yesterday, from Excelis, just telling everyone this change is going to be happening, and kind of how that's going to work. So more details will come out in November, particularly if there will be any change for you from the current coverage, which we'll talk about in a little bit. And then in December, everyone that's employees who are on the insurance and any of their dependents will be receiving new ID cards. So you really want to make sure you look out for those, and also that you dispose of your old cards, replace them with your new cards, and update your providers, particularly your pharmacy. Because the old cards have ProAct listed as our pharmacy insurance. That will not be the case starting January 1st. Everything will be Excelis Blue Cross Blue Shield, so your doctor and then your pharmacy. But you do want to make sure that your pharmacy has those updated cards so that they know to run that prescription insurance through Excelis Blue Cross Blue Shield. If they still have one of the old cards on file, they'll try to run it through ProAct, and then it'll bounce back as there's no coverage or coverage is canceled at the end of December. So definitely keep an eye out for the new ID cards, and replace your old cards with the new cards when they come in December. So on to the changes with the medications. The costs for copays are not changing by tier. So generics are going to still be $5, and then the name brand medications will be $35 or $70 for tier 2 or tier 3, just like they are now under ProAct. The one change could be that some medications, and this will not be most medications, but some medications will either move down a tier or up a tier because Excelis has somewhat of a different formulary than ProAct. So there could be, for some folks, a medication that could become more expensive if it moves from tier 2 to tier 3, or less expensive if it moves from a tier 3 to tier 2. But again, in most cases, there will not be a change, but just something to be aware of in advance. Now, if that is the case for you, if you do have a medication that's changing one way or the other, Excellus will be reaching out to let folks know in advance that that will be happening, what medication it is, and what the new cost that they can expect will be, whether that's higher or lower. Those will be letters that are coming out to you in November. So again, that's why you really want to make sure that you're watching that mail, checking for letters from Excellus Blue Cross Blue Shield, because they could be about, important changes that you need to know about for next year. 90-day mail order is going to continue to be available. That's same cost share as you have now, which is you pay for 2 months, you get one free, which is a great savings. It's just going to be, instead of through ProAct, you're actually going to have two options. One is to set up that mail order through Express Scripts, which is the mail order pharmacy that Excellus uses, or they also partner with Wegmans. So you can get your pay for 2 months, get one free mail order set up through Wegmans. Just as easy to do both. It's really just your personal preference, what you think is the best for you, what works best for you, what you would prefer. But so that'll be the same kind of 90-day mail order, just through Express Scripts or Wegmans. Instead of right now, it's the ProAct mail order, but mail order will still be available, and it'll still be the pay for 2 months, get one free for your 90-day supply. For those of you who are using Canna RX, which is our mail order program for brand medications only, on their formulary, if your medication is on that list, you can get that 90-day supply in the mail free of charge. It's fully covered by the insurance, and we'll talk a little bit more about that in a minute. If you currently are participating in Canna RX, there's going to be no change to that program. So there's nothing you need to do differently from what you do now. That's just going to continue how it is. So some folks like to kind of double check and make sure their ducks are in a row. I know I'm one of those people. So even if, you don't hear anything from Excellus about any of your meds changing, which again, most people will not have a change. So they will probably not hear from Excellus, but if you just want to double check, make sure everything's good to go for the January 1st changeover. In December, once they have finished loading and transferring all of our information from ProAct, you'll be able to call customer service, and we have a dedicated customer service line just for consortium members. And that phone number is on the slide here. And these slides will be posted to the website after this presentation as well, so that you can print them out if you want to, or take notes down on them. But starting in December, our customer service folks, they will be able to go through all of the meds on your list, to tell you, what you can expect for copays, to tell you if there would potentially be, any changes if you, for whatever reason, maybe missed the mailing that came out. So just if you wanted to double check, make sure everything's good to go for January, you can call customer service to do that starting in December. And they'll be able to help you out with any questions you have, or help you get set up with mail order for January. So if you currently do mail order through Canna RX, then you should be able to fill your 90-day supply that's coming in the mail through December, and then you'll still get that 90 days. Or what we recommend doing if you have like a prescription that you fill kind of during the month, to see if you can get that sort of before the changeover. But really, your prescriptions, all that needs to happen to continue to fill those at the pharmacy is to get the pharmacy your updated insurance information for January. So that is basically that in a nutshell. And again, just keep on the lookout for mail from Excellus. You want to keep a lookout for those letters about if you have any medication that might be changing. You definitely want to keep a lookout for new ID cards coming in December, and you want to make sure you update your providers, particularly your pharmacy. And then in December, you can give a call to customer service just to make sure everything is good to go for January. Okay, so then we're going to talk about the health insurance plan for 2024. And so for folks who aren't really familiar, the county's health insurance plans are part of a bigger organization, which is the Greater Tompkins County Municipal Health Insurance Consortium, kind of a mouthful. But basically what that is there are municipalities all around our area that kind of get together to pool resources to be able to provide health insurance coverage that is quality coverage at a lower price. And currently, as of this year, we have 61 municipalities in the consortium. And so premiums that are collected from the employer and participants. So for us, the county pays 80% and you would pay 20% for the monthly premiums. That money is put into a pool that's used to pay our claims for when folks, go to the doctor, go to the hospital, pick up for prescriptions, etc. We partner with Excellus Blue Cross Blue Shield for two reasons. One, they process our claims for us, and then also because we partner with them, any of their providers in their network are in network for us, and they're one of the biggest networks, both locally and across the country, and they actually have international coverage as well. But all of the plans are written by the consortium. They are nonprofit. We are self-insured, so Excellus is not making any money on us in terms of profit, anything like that, which is a really nice thing to know about our health insurance plan. Also, the Platinum plan is a PPO plan, and basically what that means is you can go see any kind of doctor you want, make an appointment with a specialist. You don't need a referral. And then there will be some level of coverage. So we'll get into the difference in just a moment between in-network and out-of-network providers, but you can go see any provider you want. But if you see an in-network provider, it's going to be more cost-effective. It'll be less expensive for you. And then on the upper right-hand corner here, we do have our 2024 rates per pay period. And then also a summary of the prescription copays. If you are currently on one of our other plans, the Classic Blue or PPO, we will be reaching out directly to folks in that situation with cost and summaries, things of that nature. There are no changes to those plans and how they work other than the rates. So we will send those out this afternoon for folks who are still on those plans. So a little bit more about the benefit of choosing to go to an in-network provider. Basically, it's really the most cost-effective option. It's the lowest copays. There's no deductible in order to go to see an in-network provider. But that said, if you have an out-of-network provider that you really love and you want to keep going to see them, our out-of-network benefit is actually really quite good as well. And I will go into that on the next slide. For finding an in-network provider, you can check the website and I'll show you how to do that. You can call that customer service line I mentioned before, or you can just ask the doctor, do you take Blue Cross Blue Shield? Any kind of doctor that takes any Blue Cross Blue Shield plan will take our Excellus Blue Cross Blue Shield plan. So this is just a little bit of an overview of how the plan works for folks who aren't that familiar. So basically up at the top here, you'll see a deductible. And basically what that means is it's an amount of money you would have to pay down before the plan would start covering. So again, like I was saying before, if you go to an in-network provider, there is no deductible. There's nothing to pay down before the plan starts working. It'll just start covering at the copays that are listed below. Then for out-of-network, you will see that there are deductibles on that plan. It's $500 per person. So if you're on a family plan and there's only like you and a spouse or domestic partner, or you and a child, you would not be responsible for more than the individual deductible each. So that's $500 per person. But if you've got a family more than 3 people, it's only that $1,500 total. And actually, in terms of a deductible, that's actually a very small deductible. And then also, when you see coinsurance, the difference between in-network and out-of-network is in-network has co-payments. So you can see sort of at the bottom there, you go to your primary care doctor, it's going to cost you $15. You go to a specialist, it's going to cost you $25. And that's great because one, those copays are really pretty low, but also, you know you're going to get the service and you know what it's going to cost. So there's a lot of clarity around those expenses and what you can expect to pay. It's a little bit different on out of network. It's co-insurance. And what that means is you're responsible for a certain percentage of the cost of whatever the service costs. So that co-insurance amount that you would be responsible for would be 20%, and the plan would cover 80%. In terms of co-insurance amounts, that split honestly is about as good as it gets. The position I had before I came to the county, that was my in-network benefit, the 20% co-insurance, 80% the plan would cover. So in terms of that, if you have an out-of-network provider that you want to see, again, it's really quite a good benefit for out-of-network as well. Next concept on this slide that's pretty important for folks to understand is the out-of-pocket maximums. So what that means is, say you've got a really bad year, you've got a lot of healthcare expenses going on. That amount there is, if you hit that amount that you have to pay out of pocket for prescription, medical, hospital, all that stuff combined, you won't have to pay anything for services for the rest of the year. So that's really great, because that essentially means, like, even if you have like a catastrophic year, the most you would be on the hook for, in network is $2,000, out of network $3,000 for the year. So, if you hit that amount, you don't have to worry about, like, am I gonna like lose my house or my car because I have these huge medical expenses that I can't take care of. This is a worst case scenario. People rarely, if ever, hit that out of pocket maximum, but it's good to know that it's not going to be nearly as bad as some other plans could be in terms of that. So this is just more examples in your packet that went out for the open enrollment 2024 benefits. It has a pretty full list, more things than this, but I just wanted to put this up here for more of the kind of common services that folks would take advantage of, just so you can kind of see that difference between in-network and out-of-network that we were talking about before. Where the in-network is, you're going to pay that copay, what it's going to be coming in. Then out of network, it's that co-insurance. You pay 20%, the plan pays 80%. That's a pretty good cost share. The only thing is, different providers might charge different amounts for the same service. So depending on how much they charge when they're billing it, you have to pay 20%. That could be more or less, depending. So good cost share split on the out of network, but you don't really have that visibility and that clarity of exactly, how much it's going to be when you go in. Okay, so prescription coverage, we talked about this a little bit already. Retail pharmacy, the copays are the same this next year as they are this year. Tier 1 is your generic medications. That's $5. Tier 2 and Tier 3 are your name brand medications. Tier 2 are the name brand ones that have been out for a while. Typically, those are the ones where they're offering like a discounted cost to the health insurance company, the prescription insurance company that they're partnered with. So in this case, it would be through Excellus Blue Cross Blue Shield. In 2023, it was through ProAct. The Tier 3 meds, the most expensive meds, are the ones where, they just came out. They're brand new. They're not giving a discount to anybody through the insurance. They're the most expensive meds. But again, you can set up mail order for these medications. If they're, any meds that you take in an ongoing fashion, you get a 90-day supply in the mail. You pay for 2 months, you get one free. So if you've got meds that you're going to be taking, every month, whatever, you can save like 33% just by setting up mail order, and then you don't have to worry about like going to the pharmacy to pick it up. And then once we move to Excellus Blue Cross Blue Shield in January, you can choose whether you want to set up your mail order through Express Scripts or through Wegmans. And that's just really your personal preference. And then for the CanRx program, which is a program that is part of our health insurance, where this is for specifically name brand medications. And honestly, a lot of those Tier 3 ones would be the ones that are likely to be on this list. So if you have any medications that fall on the CanRx formulary, you can go to their website to check. It's there. So you go to that website and it's going to ask you for like an ID code so that it brings up the meds that are specific to us as part of the consortium. You're going to type in the GTC MHIC. It'll show you the ones that are available, but there'll also be a phone number there. You can just give them a quick call and just say, hey, I'm taking all these meds. Are any of these available through your program? And they will work with your doctor to get that all set up for you. That could be just, if you have any meds on that, it's an incredible cost savings because, like I said, those will be the ones that are probably like in your tier 2 or tier 3, mostly tier 3 medications. So, if you're going from spending $70 a month to having it fully covered by the insurance, then that can be really significant. So I do recommend everybody check that out. See if there's any meds that would qualify for that program, because it can just save you just a ton. Okay, so then I'm just going to go on to, we did a little bit of a trivia question earlier in open enrollment about the program that's available through our health insurance plan that can get you discounts on gym memberships, on LASIK, on fitness related services and apparel, things like that. And not a lot of people knew what it was. So we're going to talk a little bit about that program. It's called the Blue 365 Discount Program. And we're also going to talk a little bit about how you can access all your insurance stuff online, because that's a great tool for you. You can request new ID cards. You can print out temporary ID cards. You can check how much it'll be as a copay for any kind of service you're thinking about getting. You can search for providers. You can do a telemedicine appointment for physical, mental health, even speak to a psychiatrist. So there are just tons of resources on the website and folks don't really use that so much, but it's worth taking a look. So we're just going to take a minute to go through that so you can kind of see what that looks like. So the first thing is, this is just their main website. You're going to go to just excelusbcbs.com. And then in the upper right-hand corner here, there's a login register button. If you're already registered, you can just hit login and log into your account. But if you've never done that before, you can just register. And I do recommend, doing that. Even do it this afternoon, because there's so much stuff that you can see there. And then you just put in your information, they can find your account, and you can kind of get started. So this is where if you click on login or register, it's going to take you to something like this. You can log in if you have your login here on the left, but if you've never set this up before, it's your first time doing it, here are the steps for creating an account so that you can do all the things that you want to do online. So once you log in, this is going to have your information about what your plan is, your subscriber ID. You can set up paperless settings, view all your statements, your plan members, plan start date, effective date. Over here's member cards. You can get new cards. Down at the bottom, you can see your coverage for in-network, out of network. And then right here where it says search within your benefits, you can say, gosh, I want to go get some acupuncture. Let me see what that's going to be like. And then up at the top, you can see your history of claims. We will actually have prescription functionality once we move to Excelus Blue Cross Blue Shield. So that'll be a huge benefit that we'll have starting in January. You can search for a doctor and more. So over here's an example of if you're going to search for something, and I'm using acupuncture here. So you just search for it and then you find the service and it'll tell you how much it's going to cost. So an acupuncturist counts as a specialist, so it would be that $25 copay. Or if you go out of network, it's a 50% co-insurance for this. It's kind of an added on benefit that's not part of like a traditional medical plan. So that's going to be a little bit different than the 20/80 split for most services. And then there's that limit of 10 visits per contract year. That's January to December for us. We follow a calendar year. So it'll just give you all these details here for, what you can expect if you go to get that kind of service done. And you can search for any kind of service you want to do. If you have difficulties, you go in here to search for something you're going to get done, you can't find it. I'd recommend giving the folks a call at that dedicated customer service line. They can help you more. It could just be like a wording thing or whatever. And then if for whatever reason you've got something going on, whether you're not sure what the coverage is going to be or you're having any kind of difficulties, that's when you'd want to get in touch with Jess or with me, and we can kind of delve further and kind of look into it and have our account managers get involved or the consortium get involved if we need to. But the folks at the dedicated customer service line can really help with most issues, and they can do that kind of faster than coming to us, and then we go to them and kind of have to take a little bit longer time to get those answers or get things resolved. So we do recommend reaching out to Excellus first. If they can't help, we are more than happy to help you kind of figure out whatever it is. So, never shy away from contacting us if you have questions. But it might be worth reaching out to Excellus for some things first, because they might have the answer right there, and then you can get it right away, as opposed to us having to, research for you. So this is just a look at that bar on the top we were looking at before, how you would find a doctor. And this is local or national search. So say, you're on vacation or something and you need to find a doctor in that area. This helps you look for local resources, national search, whatever. And then they'll ask you what kind of thing you're looking for, what you want to search for. And there's a lot of options for looking there. So say you want to look for a primary care doctor by specialty, then they give you sort of options here that you can choose from. And then they'll give you kind of a list of in-network doctors to choose from. We also have telemedicine, which is a great benefit that folks are using more, since COVID really is kind of when it took off. But telemed is great because you can just log into your Excellus account online. There is a little bit of a setup thing, and I have instructions in here, and there are also instructions on the Excellus website for, how to do it if you're not familiar with it. But it's a great way to reach a doctor, and this is 24/7 access to providers, which is fantastic. If you've got something after hours, you've got something on the weekend, you've got something going on, you're not really sure, like, how serious is this? Like, do I need to go to the hospital, or do I want to talk to a doctor and kind of see what they think? This is a great way to do that. Or also, like, if it's just a standard kind of thing that you've had going on before and you just need a doctor to call in, like a prescription or something, a lot of times they can do that by just logging in and doing a telemed visit. You can get it done and dusted like nearly immediately. So that's really worth looking at setting up. So this is from the Excellus website. There are little videos they have to kind of talk to you about how it works, how you do it, frequently asked questions. Copays for telemedicine are just your $15, which is your primary care copay. So it is really great, an affordable, option. And I'd like to take a second to look particularly at the therapist and psychiatrist options available through telemed. Unfortunately, it can be really difficult, particularly locally, to find mental health resources like this. And honestly, most providers are doing telemed for that anyway, even if local. So I'd say if you or a family member have been struggling to find a provider for mental health services, it's really worth considering telemedicine and reaching out and seeing if that's something you can do ongoing through that service, because it's just so convenient, it's affordable. And it might be a lot easier to get in through this program, which has resources across the country, if you're not able to immediately get in with a local provider. That is also there as a resource for you. Okay, so we're on to the Blue 365 discount program. This was the question we had in our little trivia question that not a lot of folks knew. So Blue 365 are all of these fitness providers that are going to give discounts to folks who are enrolled in a Blue Cross Blue Shield plan. So they partner with Excellus, in our case, but with Blue Cross Blue Shield to offer these kind of discounts. So when you go in and log in on your home screen, you'll see this button where it just tells you kind of, oh, Blue 65, get rewards, learn more. So you'd want to click there. And then it'll just take you through kind of, here's what it is, view the discounts they have available. These discounts are changing and updating all the time. So it's something, you want to go in and check regularly to see if there are new offerings. Once you check to see more, it's going to take you to the Blue 365 site. So you'll either sign in if you have a sign in, or you want to click join. So they're a partner with Excellus, but it's a different login than when you log into your main Excellus account. So if you haven't set up an account with Blue 365, you can link to it right through your Excellus page, but then you're going to want to either hit sign in or join. And then you can see kind of all the deals that they have. And there's some great stuff, like significant deals on LASIK, discounted gym memberships, discounted stuff for like, vitamins, nutrition stuff, fitness apparel, sneakers, Fitbit, lots of stuff. So this is an old one. I don't think this is a current one, but this is as an example, like up to 55% off of Garmin, Polar, Fitbit, things like that. So like I said, if you're interested in gym membership, LASIK, if you're interested in glasses discounts or other fitness gear, I just really recommend giving it a look and then checking in on it fairly regularly, because there are a lot of new offerings that are just available to us for being a Blue Cross Blue Shield members. So, might as well get the most out of our health insurance. Unfortunately, health insurance is pretty expensive, although pretty important. Might as well get like the bang for the buck in checking out these deals. I really recommend it. Okay, so that is our health insurance summary in a nutshell. Jess, are there questions that came in about that before I kind of move on to other stuff?
There are some things that have come in, yes. So some of them go back to the prescription coverage. So the first one, will my provider need to write new scripts and send them to Blue Cross Blue Shield, Express, Wegmans?
So you would need to set up a new mail order that won't transfer over. So you'd want to do that with your provider in December, January. If you fill your 3 month supply in December, obviously you're not going to run out until like February, March. But you do want to set up a new mail order with a new mail order program. For your regular prescriptions, it should carry over. You just need to update the pharmacy with your new insurance information.
The next one is, do prescription expenses count towards reducing the annual deductible?
So for prescription, in network, mostly anywhere you go is going to be in network. So there would be no deductible that they would be counting down towards. Like pretty much every pharmacy in the country is in network with Excelis. So
they have been the out-of-pocket maximum.
Yeah. If you mean the out-of-pocket maximum, yes, all prescription and then your medical stuff, medical appointments, hospital, anything like that. But yes, prescription counts towards the out-of-pocket max as well. Yeah.
Okay. And then we have a couple that are about flex spending, which I know we're going to get to.
Yep, let's hold those because we're going to get to that whole section on that in a minute.
What if I need to exceed the number of limited visits? It seems wrong that the insurance company can override your doctor's order.
So the insurance will basically pay for a certain number of visits, but there are very few services that we have that have a limit on visits. Acupuncture is a weird one because it's kind of like an add-on supplemental benefit. But for most services, there's not going to be a limit like that. So I would recommend for sure checking in with the folks at customer service. If you need our help, we can check in on the limit. You could still get more services, but it's just that the insurance will only cover up to whatever amount if there is a limit. So then that would mean essentially, out-of-pocket expenses for continuing past whatever the insurance would cover. If that were something to happen, and again, with most of our services, nearly all of them, there is not a limit. But if that were to happen, that would be something where you could use funds from your FSA or your HRA VIBA account to cover that kind of expense should that occur. Not likely. Again, look into it with the customer service folks, check in with us, just so we can make sure for you if it is something that does have a limit like that.
And then lastly, do you need to schedule a televisit a special way to get the $15 copay? I had a televisit with a specialist and was told it was the same copay as in office.
So that depends. If you go to do a telemedicine appointment, like with one of your providers that's not a part of that program through Excelis, it would be the normal copays. But if you do the telehealth through the Excelis plan, I'm using their providers, then it would be those $15 copays. So like, for example, I know I have some doctors who are just local doctors and I do a telehealth appointment with them, normal copays. If you go through that specific program that Excellus has that you can access through their website and use their providers, it's that $15 copay. I know that could be probably a little bit confusing. But that's kind of the situation. But yeah, if it's a local provider, normal copays. If it's through Excellus's specific program, it's going to be those $15 copays.
And that is it for now.
Okay. And yeah, folks, if you think of something else, keep putting it in the chat. And we will definitely get to those things as we go along. So another thing that I think Jess and I both talk to folks all the time, and they don't really realize that this is part of their health insurance plan. But if you are enrolled in health insurance through the county, every January, you get an annual HRA, used to be called VIBA, deposit. So what that is an account that the county sets up for you that they put money in for you to use for yourself and your family members for health, dental, vision, prescription expenses. So that is basically free money that the county gives to you pre-tax. It doesn't count towards, your annual earnings. So nothing like that. And then you will get in the mail a debit card from Benetech. Those are the folks who handle this benefit for us. They send out new ones every 3 years. So if you currently have one, don't throw it out. But if you're new to this and January 1st is going to be, your first year, they're going to mail that card to you in the mail. Don't throw it out. You can use that card to pay for copays when you go to the doctor, for picking up your prescriptions, for certain like over-the-counter medications, things like that. And so the amount really depends on your bargaining unit and your date of hire and whether you're individual or family plan. But for most folks hired after like 2015, it's going to be $250 for an individual if it's just you on the plan, or $500 if you have a family plan. So that's a really great benefit that is part of our health insurance plan. You don't need to do anything to enroll or sign up. It is automatic. Also, a great thing about these funds is that they never expire. They carry over from 1 year to the next. You can accumulate a balance. Even if you leave employment with the county, those funds are yours to use until you exhaust them. One other cool thing about them is if you kind of bank them up, you can use that money to pay for retiree health insurance premiums once you retire. So I know for myself, I'm like trying to bank that up every year, save it so that, when I get there, I have a nice nest egg to pay for retiree health insurance. So that's kind of a great thing that the county provides, and you get it automatically as part of your health insurance if you're on the plan. So again, keep a lookout for that debit card. If you already had one from last year before, hold on to it. They last for 3 years. So if you've had one for a couple of years, and it says, if you're looking at that expiration date and it says it expires at the end of this year, Benetech knows that. They'll automatically send out new cards to folks if they are expiring. So again, if you're looking at it and it says it expires at the end of this year, they're going to mail you another one. Just keep an eye on the mail. Don't throw it out. Okay. Next thing. Okay, so this is for the Blue for You Wellness Incentive. That is also something you have access to because of your enrollment in the Platinum plan. And so this is also something where you do have the option to send any money you earn for this to your HRA VIBA that we just talked about. So basically what this is if you were here this year in like February, March, you probably heard all about this. So what it is there's a health and wellness screening that you can do every year, and we will send out so much more information about this in January, February of this coming year. But I just want to make sure that everyone knows that if you're in the Platinum plan, this is something that's available to you every year, to you and to spouses, domestic partners. Where you can do this health screening and you earn a cash incentive for each of these categories. So they measure your blood pressure, your LDL cholesterol, triglycerides, glucose, and whether or not you use nicotine. And then for any of these that you hit target ranges, you get this cash bonus that's listed here. And so on the next slide, we're going to kind of get into, if you do your health screening and you don't hit all these, or maybe you only get one or two, you have the option to do health coaching so that everyone that participates does have the ability to earn that full incentive. We've really worked hard to design this so that it's a program that everyone can take advantage of, that everyone can get the full amount of money from, not just folks who are, young and healthy. It's really designed so that everyone can get a full incentive if they do take part. So there are a few different ways to do it. The easiest and that we recommend is we have several on-site clinics where nurses come and they'll just do a quick blood draw, take your blood pressure, and then that's it, in terms of the screening. But if you prefer, you can also go to Well Now, which is a local urgent care center, to get this done, or to your own doctor to do it. So there are options for how to do the screening. If you do one of the on-sites at work, that's actually considered part of your work hours. So you don't need to take, any of your fringes or anything like that. You just set up an appointment time, you go while you're on the clock. It takes like 5 minutes. They do a quick blood draw, blood pressure, and then you're all set with the screening. Just so folks are aware, if there's anyone on the call from the corrections unit, this program's not available yet to the folks in the corrections unit, but everyone else does have this program. So I'd mentioned before the health coaching. And so this is, say you do the health screening, and you don't get some of those categories within the typical ranges, then you can set up 30-minute phone calls, or they can do video calls to chat with a health coach free of charge, to kind of get credit for any of those missed ranges. So say you missed 1 to 2, you can talk to a health coach for 1 to 2 sessions. They're about half an hour long. You missed 3 to 4, you can talk to a health coach for 3 or 4 sessions, again, about 30 minutes in length each, to make up that credit for any ranges that you missed. If you are currently using nicotine, then they have a program that's like an 8-week smoking cessation program to take part in. So there's no re-measuring to get credit. It's based on if you participate in coaching. They're not going to check and make you hit healthy ranges or anything like that. Again, it's just really, did you do the coaching? You get the credit. And IH21 is the company that administers this program for us. They don't give us any of your personal health information. All they do is they give us a list of names, how many credits out of 5 they got, and that's it. They don't say whether the credits were gotten on the original one, whether it was through coaching, which categories people got, which categories people didn't. Just a name, a number of categories, and then we pay folks out based on that. So, we're not going to get any of your personal health information doing this program. So another important thing is exemptions. So we recognize, obviously, that there are folks who may have a health condition or whatever that, it makes it inadvisable for them to maybe participate in some of this. Or it's something where they're never going to hit a standard range. And that's fine. It's just in that case, your doctor will talk with one of the providers at IH21 to kind of just get you credit without having to go through coaching. Like a good example of this is, say someone who's, cholesterol is outside of the typical range, but that person is taking cholesterol medications, checking with their doctor, working on a diet and exercise plan, and really their numbers are good for them, but they're never going to be like the typical range. Well, that's fine. They can get credit for that regardless. It's just a matter of someone talking to their doctor and having them, talk to IH21 and say, hey, this person's not going to get the range for whatever reason, but this is something that's being addressed and they should get credit and not have to do the health coaching. So that's a really good benefit. That's part of it too, just to make sure that everyone can get full credit. So then after you do the screening and any health coaching, you've got options for how to receive those funds. So we were talking about the HRA VIBA account before. This is something, if you do the wellness program, you can have those funds also go into your HRA VIBA account too. And so that if you do that option, there are no taxes. Those are funds that you can bank up year to year, that you can use for retiree health insurance, that you can use for healthcare expenses for yourself and for your family. They're funds that stay with you after you leave the county, so you can still be using them. You're at a different employer, you're on their health insurance plan, you can still use this money to pay your copays, prescriptions, any eligible expenses. So that's great. But you do have more options because that's, not the best option for everyone. You could take a lump sum cash bonus on your paycheck, or send it to deferred comp if you want. Something just to keep in mind about the lump sum cash bonus. Unfortunately, the IRS makes us tax cash bonuses. So that's just something to be aware of, that it will be taxed. And then for deferred comp, state and federal taxes are waived, but it's still subject to FICA and Medicare. So there would be a little bit of that coming out as well. But again, if you do it to the HRA VIBA, then no taxes, you get the full amount. So health insurance buyout stipend. If you're on this call, this probably doesn't apply to you, but we will go over it really briefly. So this is for folks who, if they're benefits eligible, but they don't end up enrolling in a county health insurance plan, then they're eligible to receive an annual stipend amount of $1,500 for most employees, $2,000 for sheriff, if they show coverage, proof that they're covered elsewhere in 2024. So that's like a one-time bonus that's on a paycheck in January. Something to just note about this, should this apply to anyone on the call right now, is that stipend is for the whole year. So if you were to receive that stipend and leave county employment mid-year, or maybe you've got a life event, so you end up enrolling in the county insurance plan mid-year, then you would be required to pay back a prorated amount of that bonus, just because it is full for that full year. So, okay, flex spending accounts. Jess, is there anything we should talk about HRA specifically before we go on to the next thing?
So we did have a couple pop up. So one said, is this benefit for retirees also? I'm not sure if they were referring to the HRA or Blue for You. I didn't get a response.
So for the HRA, you wouldn't be getting new deposits each year, but you would be able to continue using the money that was in your HRA. For Blue for You, retirees can participate in the program, participation only, but they wouldn't get that financial incentive for participating. That makes sense for either one of those.
And then what happens to the money in your HRA account if you pass away?
So that is a great question. There's basically an order of beneficiaries where that would go to. So typically it would go to first a spouse, if there was no spouse, to children. Beyond that, it would go to like a state, that kind of thing. So that money wouldn't just go away. But there's an order if they look at, who are your closest family members, and kind of what would happen with that. If you don't, whoever's asking, if you don't currently have a spouse, domestic partner, or kids, reach out to us and we can kind of get you that full list. But if you do, then that's kind of where it would go. If you were to pass.
Okay. And then I don't know if we want to do these now or hold them. Some questions did come through about Blue for You as well.
We can talk about them briefly, sure.
Okay. So one, according to your slide, employees on PPO and Platinum are not eligible. Is there more than one insurance plan?
So folks on the Platinum plan are eligible. The folks who are not eligible are the folks on the old grandfather clause, classic Blue, or PPO plans. There are only a handful of folks in that situation, but this program is actually part of the Platinum plan. So folks on those two older plans would not be eligible for that program. It's just the Platinum plan.
Yes. And I think where the Platinum not being eligible may have come in, the corrections unit has not adjusted
the
incentive for it.
Yep. Corrections, this does not apply for yet. So. Yeah.
And then for the wellness incentive, do you need to use your fringe time to complete the coaching sessions?
No. They have weekend and evening availability. But you can do that as part of your workday. However, you do want to check in with your department, to make sure that there's adequate coverage before you do something like that. You don't just disappear for half an hour and no one knows where you are and there's not coverage. So that's something, yeah, you'd want to talk to and get approval for, but it is possible. Yeah.
And then the last one, are you dropping Guthrie for the wellness incentive screening?
Yes, that has not gone well for us. It has not gone well for our participants. So we will not be utilizing Guthrie as a lab option for 2024. It would be just well now. If IH21 partners with another provider, we'll take a look at that. But the Guthrie did not. We thought it was going to be a very convenient option for folks. A lot of folks really like Guthrie. We do too. But it didn't work out well with IH21 and their billing stuff. So we will not be moving ahead with that.
And then there was one that said $350 is deposited where, but just after that, we went over the slides on where you can receive those incentive funds. So,
Okay,
and that is it.
great. So flex spending accounts, they're kind of similar to the HRA we talked about, only instead of the county putting that money in, that would be money that you were choosing to put in to that account. So that money would go into your account pre-tax, so it would lower your taxes. And there are two different kinds, healthcare and dependent care. The healthcare FSA is very similar to the HRA plan, to the VIVA plan. The same expenses are eligible. A couple differences are that it doesn't carry over year to year other than a certain amount. So in 2023, up to $610 of unused funds would roll over to use the next year. In 2024, we think that's going to increase to $640. That would roll over, but that's not set in stone yet. So unlike the HRA, which just you add to forever and ever and it rolls over, there is that limit on the healthcare FSAs. Mental note, just if you're in an FSA this year, a couple things are really important. One, this has to be elected every year. So we would need a new enrollment form for you for 2024 if you want to keep participating. And then also, if you've got a lot of money left in your account and you're looking at it and you're like, I don't think that I can get through this by the end of the year. In order to get that rollover, you do need to be re-enrolled in the FSA. So you want to make sure that you do that. Even if you elect just the super minimum so that you can get the rollover, you do want to make sure you do that. And so if you've got money in there this year, you don't have to use it all up, but you do want to make sure you get it down to this year what it's 610. Next year we expect it to be 640. We also think that the maximum contribution is going to go up. Currently it's 3,050. We expect that to go up to 3,200. The only expense that the healthcare FSA can't be used for, that the HRA can be used for, is retiree health insurance premiums. But for your health, dental, vision, prescription expenses, over-the-counter medications, it's the same eligibility as the HRA. And also, if you've got that Benetech card for your HRA, that same card works for your flex spending account. It's loaded with funds for both. And how that works is it'll pull funds from your FSA first. And if you use all those up, then it'll start pulling from your HRA. But the reason it does it that way is because your FSA funds have the potential to, some of them could expire. So it want to make sure that you don't have that happen. So it's going to pull from your FSA first before it moves on to your HRA if you've got both of those set up. For the healthcare FSA, whatever you elect for the whole year, that'll be split up into 26 pay periods, and you'll pay back in a little amount out of each pay period, but your whole annual amount will be available for you to use as of January 1st. And that's really helpful if, like, say you've got like a bigger medical expense planned for like January, February, you've got all that money available to you right away. And then you just kind of pay it back in gradually throughout the year. Dependent care FSA is a little bit different. So this is for if you've got daycare expenses, after school program, summer camp for kids up to age 12, those expenses, they get paid in each pay period throughout the year up to the maximum election of $5,000. But those funds only become available as you pay them in. So what folks do a lot of times, particularly like they've got daycare expenses for a young child, they'll kind of save up their receipts and then send them in batches to get reimbursement as the funds become available. But that is just a difference to keep in mind between the healthcare and the dependent care. Healthcare FSA, it's all in there as of January 1st for you to use. Dependent care FSA, it goes in gradually throughout the year as you pay it in. Okay. So something important, particularly for this year, very important. You have 90 days into the new year to submit for reimbursement for expenses that were incurred the previous year. So that's expenses from January 1st to December 31st. You have 90 days after that to submit those expenses. So typically that's until March 31st, but 2024 is a leap year. So that deadline is March 30th instead of March 31st. And the IRS is super strict about that. They are not going to give you wiggle room if you try to turn it in on the 31st versus the 30th. So it's very important to make sure that that is done in a timely fashion. And also for if you're submitting for 2023 expenses in 2024, that is going to need to be done using the paper form versus in the app or on the website because they'll need to kind of go back to get those funds from the last year after they've rolled over to 2024. And so they can't do that through the app after the start of the new year. And if you're curious about eligible expenses, and this is for your HRA or your FSA, going to fsastore.com, there's an eligibility list. It's updated in real time as things change for eligibility. And I recommend going to take a look because there are so many things that are eligible, way more things than you would think. So I really recommend taking a look at that. Are there any FSA specific questions that came in?
There are one, just what is the minimum amount for the FSA?
It's $10 per paycheck. So that is $260 for the whole year, which is under that cap that'll roll over. So, you know, if you do elect that minimum amount, you're not at risk of losing anything because it'll roll over for you to use the next year. So that's pretty nice.
And then there was just a comment relating to Blue for You, but overall general. It says, well, now is dropping Excelis Blue Cross Blue Shield. In January of 2024, they will no longer accept our insurance.
That is actually really up in the air. So what's kind of going on with that situation is that WellNow is kind of bargaining with Blue Cross Blue Shield because WellNow is in a situation where they feel like the compensation they're getting from Excelis isn't fair. And so basically they're saying to Excelis, you know, unless you change this, we're going to leave your network. And Excelis obviously does not want WellNow to leave their network. So I don't know for sure whether that's going to be resolved or which way it would go. I would expect that before the end of the year, Excelis and WellNow would sort that out. But if they don't, we will have alternative options in terms of the Blue for You program. But I am hopeful that that's something that they will resolve before the end of the year.
And that is it as of right now.
Okay, well, we're in the home stretch, everybody. I know it's like 2:00 now, but this next thing will be pretty quick. So this is just looking at our CSEA dental and vision plans. All employees aside from blue collar are eligible to enroll in the Duchess dental plan. Blue collar employees are eligible to enroll in the Sunrise dental plan. Both of them are really great plans with comprehensive coverage, no pre-existing condition exclusion, no waiting period for certain services. They cover implants and child and adult orthodontics, which is great. On the CSA website, you can search for in-network providers. In-network providers have agreed to accept what the CSCA plan pays as payment in full, so you wouldn't have out of pocket. That said, you can go see any provider you want. CSCA will pay the same amount for it, but just if that provider charges more than what CSCA will pay for that service, you would just be responsible for paying the difference. The Platinum Vision Plan is available to all employees. These plans have what is called composite rates, which basically means it's the same cost no matter how many dependents you have on the plan. So, if it's just you, it's going to be the same cost as if you have a big family on the plan, which is odd, but that's how they do it. So these are the rates for the Duchess Dental Plan. Their rates change mid-year, and they're the only benefit we have that does that, which is weird, but that's why you see through 6/30/24, it'll be this, and then starting 7/1/24, it'll be this. It's not much of a difference. So this is biweekly. That means out of each paycheck, other than pay periods where we have an extra paycheck, so it's only twice a month. And then you can kind of just see the high level overview of sort of how much these plans cover. And they're honestly the best, most comprehensive dental plans I've ever worked with. The only thing is, if you go to see an out-of-network provider, you just really need to know how to utilize that insurance, which is basically talk to the provider, and either they'll do one of two things. Either they're willing to bill CSEA EBF first and then bill you for the difference. That provider might ask you to pay up front, and then you would submit to the Duchess Dental Plan for reimbursement. So that's just something to know, going into the provider, if they're out of network, are they willing to bill the insurance and then charge you the difference, or do you have to pay up front and then submit for reimbursement? Either way it works, but it's just really good to know, if you're going to need to pay up front and then submit for reimbursement. That said, the amount that it pays towards services is great. The annual cap per person that they'll pay out is a lot. The coverage for orthodontics and for adult orthodontics is a lot. And those don't contribute towards the annual max. So that's great. They even do implants to a year, and that cost doesn't contribute to the annual max either. So it's just really comprehensive, fantastic coverage. You just need to know how to use it. Sunrise Dental is very similar. For those who are employees before 1/1/19 in the blue collar unit, this is paid for by the county. If you were hired after 1/1/19, it's paid for by the employee. These are the costs for the Sunrise Dental for the blue collar. And then we've got our vision plan, which is basically, in a nutshell, you can kind of see the cost here and the sort of coverage that they give you. Basically, if you go to essentially, your local Vision Works or whatever, you basically get like a free pair of glasses or like set of contacts a year with your exam. They do have out-of-network benefits, but they're really small. I really don't recommend doing the out-of-network benefits. Honestly, I would just take a look at the in-network providers, see if that's going to work for you. If it's not, I honestly don't think that it's worth doing the vision. That said, I'm fine with Vision Works and I'm fine with do that. And it's a great benefit every 12 months. And you basically get like a full pair of glasses for free. If you want to add on some of the fancier options, they're over here on the right, that it would be an added copay of this amount if you were to add these options on. And that is basically all of our benefits in a nutshell. Jess, are there any other questions in the chat? And then once we do the question in the chat, folks can unmute and just ask their questions.
We did have one more come through, just someone asking who is considered blue collar.
That really, it's certain jobs. They're typically like, say, for example, our folks at the highway department, our folks in facilities, our folks in like recycling and waste management, most folks there. If you're not sure which unit that you're in, we can certainly look that up for you and let you know.
And that is it that has come in.
Okay, great. So if anyone has any other questions, feel free to type them into the chat or just unmute yourself and ask, and we are happy to help. And then if, of course, obviously we're in a group right now, if you don't feel comfortable, feel free to email us or call us. Our contact information is on the screen right there now. So yeah.
I have a question.
Sure.
Hi. Do I need to enroll in the flex spending to get a flex spending account to use the HRA account?
No. So the
Okay.
HRA is automatic. You don't need to do the FSA to use the HRA. That would just be if you want to extra add it on.
Okay. And can you show us your vision slide again? That went pretty
Yes,
quick. Thank you.
absolutely. Here it is.
And where do I find this information? Because I found the link to the Excelis sign up form, but I didn't see the link for vision and dental and HRA at flex spending, all that stuff.
So all of these things are, actually, I'm not sure the HRA is in the, everything but the HRA is in the 2024 open enrollment packet that we attach to all of our emails. But where you can take a look at 2023 benefits, hang on, got this bar in the way. Here we go. So this is actually a great resource for folks. And we will update this with 2024 benefits when we get there. But if you go to the HR webpage, under this is 2023 benefits, this will update to 2024 when we get to 2024.
Sarah, it's still on the slideshow. We can't see if you have.
Okay. New share. Great. Thank you. Thank you, Jess.
No problem.
Okay. So if you go to the HR website, you can go to 2023 benefit rates and descriptions. And then you would just take a look at which of these categories you fall into. And then it has the current rates, the full summary documents, the enrollment forms, and the vision flex spending account. HRA is not up here. We don't really have any brochures about that. But that's something that we do communicate about and do info sessions on every January, in addition to the session that we're doing currently for open enrollment. So there will definitely be a lot more education about that.
Okay.
But in terms of the website access, things like that, it's the same as the flex spending account through Benetech.
All right. So we don't actually have to sign up for the HRA.
No, it's automatic. Just if you're in there.
Comes with the insurance.
Yep.
Okay, great.
Yep.
All right, we have had a couple more come in the chat. One, are there any other places besides Vision Works for in-network platinum vision coverage such as Guthrie?
You would want to check on the CSEA website. And how is it? I don't know if I have it. Is it on those? Oh, it is on those summaries that are in the presentation and also in the open enrollment packet. But this is the CSEA employee benefit fund. So this is the website for our vision plan and also for if you're on Duchess Dental or Platinum Vision. So if you're the member, that's you if you have that. And you can look for providers that are in network on their website. You pick whether you want to do dental vision, and then you take a look at, adding your zip code, state, whatever, and then you can search for in-network providers on that website. Or you can also give them a call and they can help you out. But I think the website's the easiest way to do that.
And then one of the last ones, when will the other benefit recorded sessions be posted? I've been letting everyone know that we'll be posting those next week.
Yeah.
While we're getting everything wrapped up, so we have them all up there at the same time.
Yeah, we're wrapping our info sessions this week. Actually, today's our last day. So we'll get everything up for next week that we were allowed to record. NISOS does not allow us to record. So we won't be able to post those, but we do reschedule those periodically throughout the year.
That is all that has come through the chat.
Okay, great. Any last minute questions from folks before we call it a day? All right, if not, and you think of something later, feel free to give us a call or an email. And we're happy to help you out. And then just remember, any enrollment forms for changes you want to make sure to get those in by the end of the month at latest. And then we'll help you out for January 1st with that.
Thank you. Have a
Yep.
great day.
You
Bye-bye.
too. Have a great day, everybody.